Towards the end of 2019, one of the trying times for the human race started after a few cases of the deadly COVID-19 were reported. Soon after, like wildfire, the virus was quickly getting to all parts of the world. This led to panic, lockdowns, and even shortages. We're all aware of the COVID-19 related toilet paper shortages, loss of scent symptoms, mask requirements, and social distance laws. These are among the pandemic's most prevalent negative effects. However, did you know the virus brought additional unexpected consequences beyond its deadly symptoms? Hello and welcome to today's video, where we will be looking at some of the effects of COVID-19 you didn't know about. As much as some of these might seem unrelated to COVID-19, they are. Also, don't forget to smash the subscribe button and turn on the post notification bell. Without further ado, let's get started. Stay tuned and be ready to be wowed by some of these effects. Number 10. Excess suicidal thoughts and deaths. In the first half of 2020, the shift from life as we knew it to isolation resulted in major mental health difficulties. While studies show that suicide rates have not increased overall, this is not the case for certain nations or groups. Suicide thoughts have also been reported to be on the rise. The Centers for Disease Control and Prevention produced a study in 2020 based on a survey of 5,412 American adults conducted between June 24th and June 30th. What were the outcomes? You guessed it right. Suicidal thoughts were found to be an all-time high among the participants, according to the study. Males were more suicidal than females. Employed people were more suicidal than unemployed people, and essential employees had more suicidal ideations than non-essential workers. Number 9. Abundance of porch pirates. The panic purchase of COVID-19 and an increase in people purchasing online have resulted in unanticipated spike in porch pirates. Since the early 2000s, the phrase porch pirate has been used to describe criminals who steal parcels from people's porches. Amazon reported a 72% increase in cash flow from 2019 to 2020. During the epidemic, individuals ordered a lot of shipments. In the United States, though, a study comparing parcel thefts, that's the thing, in 2019 and 2020 found a 7% rise from 36% to 43% of goods taken. For more specific porch pirate data, in 2020, 35.5 million Americans reported having a packet stolen, leading to a loss of $5.4 billion. Number 8. Over-drinking into alcoholism. It's easy to go to the bottle and drink your troubles when you're stuck at home, alone, and scared to death. Yes, you would be scared, so that happens. And you're scared about the pandemic's repercussions. Some individuals also claim that COVID-19 could be, prevented by drinking alcohol, which was a false assumption. Drinking alcohol does not prevent or treat coronavirus infection. The National Institute of Alcohol Abuse and Alcoholism had to warn consumers on May 12th of 2020. Although alcohol is included in hand sanitizers and a glass of wine might help you relax, consuming too much alcohol or anything in that manner can render your immune system vulnerable to COVID-19. The change in alcohol intake in 2019 and 2020 was evaluated in 1,450 persons aged 30 to 59 years. Number 7. Managers with trust issues. Since the internet-enabled corporations hired remote workers in 1999, managers have said they have had trouble trusting them. Common questions were, are they working the hours they record? Became a norm among many managers. As a result of COVID-19 driving most people to work from home throughout the world, managers are finding themselves unprepared to manage remotely. In 2020, the Harvard Business Review polled 215 supervisors and managers to see how they dealt with remote workers. The findings reveal that most people were struggling and disliked the experience. For example, 40% stated that they lacked the trust in their capacity to manage remote employees. 38% said remote workers often perform worse than those who work in an office. And 41% doubted whether remote workers could remain motivated over time. All this was thanks to COVID-19. Number 6. Spread of touch deprivation. Did you know that lack of touch would have dire effects on a person? Touch deprivation, commonly referred to as touch starvation, is a real medical disease. Humans need physical contact in various ways, and isolation mixed with social distancing has prevented individuals from obtaining the touch they require. The human touch can help you relax, build trust, and boost your immunity system while improving your health. Hugs from their spouses were shown to reduce blood pressure in premenopausal women in research. Number 5, higher domestic violence rates. We're guessing that more time at home with your family is an exciting chance for quality time. Domestic abuse has unfortunately been labeled as a pandemic thingy within the COVID-19 pandemic. Aside from the increases in instances, another problem is the inability to seek assistance while under quarantine. People who were victims of intimate partner violence couldn't phone hotlines or go to support centers because it was too dangerous. Domestic violence is on the rise throughout the world, according to research published in the American Journal of Emergency Medicine in April of 2020. COVID-19 led to increased DV in the United States, according to police department data. Number 4, more substance use and overdoses. Substance abuse is on the rise, and overdose fatalities are also on the rise. According to a CDC news release dated December 2020, about 81,000 drug overdose fatalities occurred in the United States between May 2019 and May 2020. Overdose fatalities have never been higher in 12 months. These fatalities include a 98% rise in synthetic opioid-related deaths in Western states, a 26.5% increase in cocaine-related deaths, and a 34.8% increase in psychostimulant-related deaths, such as methamphetamine. The Morbidity and Mortality Weekly Report, published in February of 2021, revealed a rise in drug usage between April and May of 2020. There were 1,004 adult participants with estimates of increasing drug usage of 18.2%. Number 3, increase in physician burnout. We could have predicted fewer beds and greater dependence on healthcare personnel as the number of patients with severe COVID-19 symptoms grew in hospitals. On the other hand, how are the doctors treating all these patients? Statistics indicate that this is not the case. COVID-19 increased the physician workload, which resulted in a great burnout. A Medscape student of 7,500 physicians conducted in September of 2020 revealed precisely how serious physician burnout has grown during the epidemic. Only 5,000 of the total doctors practiced in the United States, and 64% of these doctors claim the epidemic made them feel more burned out. The biggest sources of anxiety were treating patients who were likely to die and being exposed to the virus without sufficient protection gear. COVID-19 was caught by a fifth of doctors in Spain and the United States. Physicians who are unhappy and overworked are a hazardous one to society. Number 2, overeating into obesity. Not only is excessive obesity a risk factor for COVID-19, but the epidemic is also driving individuals to overeat. Emotional or stress eating is a regular occurrence. Food might help you forget about your bad sentiments because so many individuals gained up to 15 pounds while in isolation. The nickname Quarantine 15 began to circulate on social media. Did you know that one of the rare side effects reported by some individuals after recovering from the infection is overeating? People who lost their sense of taste or smell during their COVID-19 sickness began binge eating once they recovered, according to Indian news sources. People gain weight during their 14-day seclusion after the sickness. We are witnessing many healed patients in the age bracket of 40 to 60 years putting on weight. That's what Dr. Dinesh V. Kamath stated. Kids can't improve their immunity. Isn't it true that keeping your kids at home and away from the filth and pollution outdoors will make them healthier? Certainly not. Over clean settings may harm your young children whose immune systems are still maturing. When children are allowed to play outside and are exposed to allergens, they're less likely to acquire asthma or allergies as adults. Small children are being denied this immune-boosting chance due to quarantine. And on the other hand, staying inside will not harm your older children's immunity, something COVID-19 forced them to do. Well, there you have some of the effects of COVID-19 you didn't know. What other effects might we have missed? Please share it with us in the comment section, and don't forget to hit that subscribe button, and if you enjoyed it, give it a thumbs up. Until the following video, peace out.